Welcome to A Healthy Curiosity, the podcast that explores what it takes to be well in a busy world with self-care strategies from Chinese medicine. I'm your host, Brody Welch, here to support you on your journey of health, happiness, and personal evolution. Welcome to today's show. I'm your host, Brody Welch, and with me today is Tzipporah Gerson-Miller, who is a certified yoga therapist and a licensed psychotherapist who specializes in treating trauma, depression, anxiety, chronic pain, and body image issues using somatic psychotherapy and integrative yoga therapy. And probably these are terms that are not exactly household words. So I'm definitely going to get into what yoga therapy is, why it can be important to not only address things by talking about them, but to really get into the body in order to unpack old trauma and to really create a different relationship around some of these chronic conditions. I am super excited to have her on the show. And so welcome, Tzipporah. Thanks so much for being here.
Hi, Brody. Thank you so much for having me. I'm real excited to talk about these things today.
I have dabbled a little bit into yoga therapy. I took a 4-day workshop a while ago, which is, of course, just like the tip of an iceberg. But even just in that small amount of time that I remember some really profound experiences, including one where I was completely out of my body and hearing some serious guidance and all kinds of people and just kind of holding each other in these different yoga postures and holding space and just saying things like, what's coming up for you? Or tell me more, or like just simple prompting to allow kind of allow stories to come out and to allow energy that can be trapped in the body to move. And I know that there's lots of different styles of yoga therapy. I know there's lots of different kind of ways that it works, but I'd love to know, what is yoga therapy to you, and what do you want people to know about it? Because I think it's a really underutilized modality out there.
Yeah, I definitely agree. And I think that even just starting, our discourse by unpacking that term a little bit, just to kind of provide a working definition for people, I really utilize, the definition that was established by the International Association of Yoga Therapy, which I'm a member of, and I've attended conferences and, have a lot of really good colleagues, and there's a lot of good research put out by the organization. But basically, their definition is the process of empowering individuals to progress towards better health, wellness through the teachings and applications of yoga. Now, I would also add to that definition, it's also empowering groups and communities as well as families, couples. So it's really not just limited to individuals. When we look at, the idea of community from a yogic perspective, the Sangha, the community, is one of the most important components. So I think we want to include the potential for yoga to provide transformation for groups and communities as well.
So do you work with groups and communities?
Occasionally. I've facilitated groups for years. And in fact, when I started working in the field, I started by running groups, and I offered a lot of different kinds of groups. And when I started my yoga teacher training, I'd say even before I started working primarily with individuals in psychotherapy, I was working in groups, and I was running groups using yoga for folks with chronic pain, folks with really severe, persistent mental health challenges. So I have been doing groups for years. So it's one of my favorite, contexts
and
to work in.
And in that sense, is that a lot like what you'd expect at a standard yoga class, or is a yoga therapy group different?
Well, we have to remember just what distinguishes a group that is for therapeutic purposes versus a class. So a class is not going to have the same kind of screening procedures as a therapy group would. So you're going to really want to assess people, and you're going to want to make sure they're appropriate for the group and, meet the criteria. And, there's also going to be an element of processing as well with that.
Interesting.
And you wouldn't get that just in a basic, class that's taught in a studio necessarily. So a yoga therapy group, we have to keep in mind just what the process of therapy entails and what it means to be a therapist. And so we're going to be, we are going to have a different role, I would say.
So what would that role look like?
Well, I mean, when we think of, the process of therapy, there is usually, we have to think like what brings a person into therapy in the first place. And usually that has to do with something they've identified in their lives that's not working, or something that's impairing their functioning, something that is, causing them to not be able to thrive in the world. So there's a lot of different, or a lot of times it's because somebody told them to come, or their doctor recommended, or their spouse, told them they had to. So
somebody else sees a way that this person is not necessarily thriving and could benefit from an intervention.
And so then we, as the therapist, have to take into consideration, like, what's this person's level of motivation towards change? Because if a person is coming because someone told them to, they might not be at that point yet of being able to even see that there's something interfering with their functioning or their ability to thrive in the world. So there's going to be, an initial screening process. There's going to be an assessment done. And I do, a full biopsychosocial assessment. And then I have a yoga therapy assessment that is also included in that if the person, is interested in doing more of a yoga therapy approach. And then, there is a treatment plan, and we have to have goals that are defined by the client. And then we have to sort of look at the outcomes, and we have to have strategies and methods to looking to see if there's an improvement or there's a change, and to evaluate our treatment to make sure that the treatment is effective.
Yeah. So you're really wanting to get results.
Well, and I think,
forward in their healing.
Absolutely. And as a therapist, versus like my role as a yoga therapist versus my role as a yoga teacher. So as a therapist, I'm going to be, confronting someone's resistance, or I'm going to be pointing out discrepancies. I'm going to be maintaining boundaries and reflecting content. And so I'm going to be doing things that I wouldn't necessarily do if I was just teaching a class.
Who do you think you help the most in this work? Is there a particular condition or a particular kind of person? Like, who's going to benefit from this work?
I find that the individuals that I tend to be the most effective with, and I tend to have the most, I think, therapeutic, the strongest therapeutic relationship with, is they tend to be women in their 20s and 30s who are struggling with emotional regulation and impulsive self-destructive behavior. So so sometimes people come because they feel, chronically empty. They feel like they're really, they have really intense emotional swings. They're very sensitive, like little things will trigger huge reactions. There was probably a lot of neglect in childhood, and which is a great departure point to talk a little bit about trauma as well. And then, who are, because they can't regulate their emotions, they're turning to impulsive self-destructive behaviors such as alcohol use, drug use, binge eating, excessive spending, maybe high-risk sexual situations, so things like that.
Got it. So let's delve into trauma a little bit.
Yeah.
First of all, I think that might be fairly obvious to people that trauma can be a disruptive force in someone's life. How can yoga help us overcome trauma?
Well, we have to remember that trauma lives in the body. And trauma is a condition of the nervous system. We have to remember also that trauma is not just the things we see on the 5 o'clock news. So things that we see on the news are extremely traumatic, not just for the people who've experienced it, but for the people who are witnessing it, from that, because we can be vicariously traumatized. So it's not just the school shootings and the car accidents. So that's a different kind of trauma. That's not personal, right? So there's another kind of trauma that is relational. And the issue with relational trauma is that it has happened in the context of a relationship, and it in a way feels very personal. And that can be cumulative. So we see people who have experienced profound emotional neglect in childhood. For example, mom and dad just were not emotionally available for that child for whatever reason. They could have experienced their own trauma and haven't resolved it, or maybe they're using alcohol and drugs, which has made them unavailable. So trauma can also be neglect, and obviously sexual, physical abuse, verbal abuse. So those are different kinds of trauma that, for folks who've experienced it in childhood, can create a lot of difficulty in emotional regulation, as we get older, and it can really start to impact our relationships, our interpersonal relationships, because we didn't learn how to regulate ourselves in the context of an interpersonal relationship. And I do not have the right as a therapist to define anyone else's trauma for them. So if somebody comes to me and says that they have experienced a trauma in their life, it's not my right to tell them that that's not a valid trauma, right? So
absolutely. We all have our own subjective experience. And so the things that we carry around as scars or obstacles are going to be really unique.
So it's what the person perceives to be traumatic.
Mm-hmm. And what's alive? You said that trauma is a state of the nervous system.
Yeah, it's a condition of the nervous system because, we take in the world through our senses, and things that we perceive in the world affect our nervous system on a very subconscious level. So I can be in a social situation and my nervous system is taking in information automatically before my mind, before my cognitive, functioning is even able to kind of like interpret what's going on. So if I perceive that situation to be threatening on the level of my nervous system, then my nervous system is going to inform, sensations in my body, which is going to inform a thought, which is going to inform an emotion, which is then going to, sort of dictate my behavior, so to speak.
Right. And the fact that if the nervous system is on guard and scanning for danger in a situation where that's not really called for, where it's a situation like going to the grocery store, or it's having a conversation that might be challenging, or that these things are not actually life-threatening emergencies, but our bodies are responding as though that may be the case and readying for fight or flight, correct?
Right. That's exactly right. And, we have all heard the example of the saber-toothed tiger, that nervous system response was functional and adaptive when we were living in that way. But now a lot of us function in the world as if the saber-toothed tiger is there all the time. And that's what keeps us in this perpetual state. And, trauma is also, the nervous system in a way is confused. It's confusing the past with the present. So I can still be triggered in a present state, moment, but really it's my nervous system is responding as if that same event was happening again. So that's where yoga is such a beautiful tool to help resolve and repair, build better nervous system resiliency so that we're able to sort of move in and out of these states without causing long-term damage to our bodies.
When someone is in a yoga therapy session, they're not necessarily encountering those same traumatic triggers potentially, right? So I'm curious as to how do you get there? What's the way in terms of being able to do that repatterning with people?
Well, I think that, we have to first look at, what Tantra Hatha yoga is, from this perspective. And we have to kind of really understand just those, philosophical and theoretical underpinnings to kind of get an idea of where we're coming from. So I'm just going to give you just like a really brief like history, just of how we came to use a Tantra Hatha yoga approach in this kind of work. So if that's okay,
go right ahead.
So long ago, there was a division in the yoga school. So they split themselves into two paths. So on one road, which, came to be known as the verticalist path, this path, they saw the body as something to be transcended and discarded. It was something that interfered with the ability to build concentration and avoid disturbance. So to them, the body was an obstacle and, possibly even a prison.
And that's a place that it's not exactly empowering for those of us who want to live in a body and be in touch with the body to see it as just this like mundane obstacle to spiritual growth. It can be kind of that looking like it's constantly something to transcend it can be pretty hard to live in the world where we actually kind of need to take care of it.
Well, and if we even kind of take a step back from there and see, how, what some of our, socially constructed beliefs are about the body. I mean, we see, what our collective culture says about the body. And, I'm saying that to be, as diplomatic as possible. But, many religions really look at the body as a place of sin, and every billboard out there, the way the media portrays women's bodies as an object, and so we really don't get, the healthiest messages all the time about the body in our culture.
And even just defining the body as its physical form, as opposed to thinking about the different layers of our being, which are also our body, even if they're less physical, and that being able to tap into the breath body, for example, or the wisdom body, that these are, or the mind body, really, that these are layers of our being that are all interrelated, and that where we can use one as a tool to access the others.
Right. And that, they're interdependent as well. Feelings we think that feelings are a function of the mind, but feelings are a physiological process, so our feelings come from a biochemical shift in the body. Like, that's a physiological thing. We feel it. That's why they're called feelings,
and then the mind makes up a story about it.
Exactly.
Like to make sense of our world. But definitely get like that. We can do a whole lot of emotional regulation by using the breath is how I often encourage people to work with that. Is just when you regulate your breath, you regulate your nervous system.
Absolutely.
You're sending that message that it's okay, that there is no emergency.
Right. So so you're regulating your nervous system, and you are also and we can talk about this in a minute, but just, how the act of using pranayama or prana is going to magnify what's already there, so in a sense, it will help to regulate the nervous system when used in a certain way, but it can also be used to raise our energy. And that's another that's another component of Tantra Hatha yoga practice.
This episode is brought to you by 11 Weeks to Level Up Your Life, my self-care boot camp and support group. Are you tired of the integrity gap? That difference between what you know you should be doing to take care of yourself and actually doing it? If so, you really belong in this course. You'll be joining an incredible group of conscious people who are serious about upgrading their food choices, feeling more comfortable in their bodies, trading stress for ease, meditating daily, making time for what matters most, and coming into better alignment with their own values. There's only 2 or 3 slots left, so if you want in on this round, visit brodywelch.com and schedule your free discovery call. I'd love to talk to you.
Just to backpedal for a minute, just to get, because I want to explain, just this horizontalist approach of Tantra yoga.
Yes, I was just going to ask you that, because you talked about the verticalist.
So the verticalists, so they wanted to control their senses, their bodies, their minds, right? They just wanted to abandon the human existence and merge with spirit. So, just giving themselves to God, so to speak.
Yeah, which is awesome if you're on a mountaintop and that's your whole life. Like, totally.
Exactly.
That can be a totally great way to go.
Yeah. And so, On a horizontalist path, however, these practices, they worship the body and mind as these really just intricate, mysterious puzzles, and they recognize that we have different qualities of energy inside of us that could be not only activated, but could also be harnessed in a sense to really dissolve the ego and allow the experience of just opening up to this divine consciousness. So, this is where the Tantra Hatha, this is where the tantric approach is coming from. And, we use these practices to, such as pranayama, to intensify our aliveness. Swami Kripalu said that, prana is anything that gives us evidence that we are alive. And that can be our joy and our ecstasy, but that can also be intense sorrow and pain and suffering.
It can all be a pathway in, right? Like to amplify our vitality. That's really where I would say, like in the Qigong tradition, in the Taoist tradition, that we use the body as a doorway. And in acupuncture and in body work and massage, where, we also use the body as a doorway to healing, that every acupoint has a particular message for the body in general. And even just doing, running your hands over your skin can be incredibly healing in terms of that helping you access your vitality, accessing even your physical body in a really simple physical way that can unlock other dimensions of who we are.
Absolutely. And, they wanted to, the really, the adepts of yoga, they believed that it's possible to become liberated and become enlightened, even if you were living in the most deplorable social situation, So it's, most of us, we want to push our negative experiences away. We want to, we're constantly looking, how to avoid suffering. And that act alone is just perpetuating our suffering when we're trying to avoid something that's an inevitable part of the human condition.
And it takes energy, right?
It does. It takes a lot of energy versus cultivating that gentle watcher, that witness that can step back and watch these things move through us as transient states, that will arise and thus dissolve. And so when we're working with trauma, because it's a nervous system condition, we have to really first start with what layer is going to revitalize a person's ability to feel. Because that trauma, especially that chronic repeated trauma, that is very complex in nature because it happened in the context of a relationship, that person learned that it's not safe to feel. It's not safe to feel the body. And so we have to kind of start with what is going to be the portal into cultivating prana, and awareness and the ability to feel the body from the inside out.
And so the first step there would be what if somebody finds themselves in that state?
Well, because using the breath really is a portal into increased levels of sensitization, I would say to start with the breath. And we need to titrate it. We need to be very mindful and careful, and we need to give people options. We need to give people permission. So I think it starts even before we start with, any teaching or application. I think we need to build rapport. So we have to establish a relationship first before we do anything. So we have to build that rapport. We have to build that trust. And when that rapport is established, then we can move into doing, just like working from there. So we even want to be mindful of how our offices are set up, no backs to the door, just things like that. And looking at where you're placing your body in relation to that person. Are you hovering over them? Is your body like at the same level? Are you both on the floor? Are they on the floor and you're in a chair? So even that, just those things we have to be really mindful of. Are we acting in a way that is predictable? So it's just like those things really have to be, we have to be aware of first when we're working.
Sounds like like all of those things are going to be about creating safety.
Yeah, it's really about creating safety, a safe container.
Yeah, absolutely. So I know we have a lot of advanced meditators and yoginis and yogis who listen to this show. So who might be pretty familiar with the basics of pranayama. Is there a go-to technique that like if we can notice that we're triggered, that we are hijacked by old trauma in a conversation with a loved one or a family member, where like we know that there is no threat to our lives, we know it's a good and healthy relationship, but the past is speaking. Do you have a tip for what we could do in that moment based on the principles of yoga therapy that you teach that could help us through that moment so that we are able to come to presence more quickly?
Yeah, what I do when I'm in that situation is I just start by taking a really deep, full breath in, like one that fills my belly and my rib cage and my chest, so that I can really feel the sensation of the breath moving into my body, that feeling of muscles expanding, and because that alone kind of brings me back into the present moment. So just first cultivating sensation and feeling with the breath. And so, when you're in a social situation, not everybody wants to, launch into a round of Nadi Shodhana or Kapalabhati, which are really, those are maybe you don't want people to see you doing alternate nostril breathing, but, if you are if you have an opportunity where you can kind of step off to the side, you can do like alternate nostril breathing is a great way to balance. But I think if you're just, what I'm wanting to teach people is how to take these tools into their everyday life without having to worry about getting a mat and getting set up. Like I want them to know that they can practice yoga every minute of the day, because yoga is a lifestyle. It's a path. And so just feeling the breath in your body and just noticing what kind of sensations ripple through the body as a result of taking a deep breath in can be really grounding.
And that's something that we can socially ask for. Like, I know, like if I were to say to my husband, like, okay, I'm getting a little triggered here, I'm going to take a few minutes, I'm going to just breathe and see if I can come back, that would be well received, like that. Yeah,
it's so simple, but it's so profound at the same time.
Awesome. And so it sounds like, breath awareness is a huge way of really being in our bodies. But like, as one of my favorite teachers, Jeffrey Yuen, 80th generation Taoist master guy who I study with a lot, he talks about how you can't breathe from the past or for the future. Like your breath anchors you to the present moment because it can only be in the present moment. And so in Chinese medicine, we think about the lungs as connecting to the corporeal soul, or the spirit that stays with the body. So if you're in the habit of not being in your body, or disassociating, or if the body hasn't been safe in the past, that the breath can be a way of coming back.
Yeah. And, I always tell my clients that, if you can take a moment and just, cultivate some awareness about the quality of the breath. The quality of our breath can inform us about our emotional state. And from there, we can kind of take a step back and we can create more space between the stimulus and the response, and therefore find that liberation, where we can act from a place of discernment and make a different choice in the moment.
I love the way you put that. It really does, like that, what working with the breath in the group coaching programs that I lead, they're basically about, they're 10 habits that we learn about just how to live, and that are from the yoga tradition as well as the Chinese masters. And being able to, like, every habit is built on a trigger, and then the behavior, and then the reward that you get from doing that behavior. And so, like, the trick to unlocking pretty much anything that we're doing in life that we don't want to be doing is an awareness of what the trigger is and what we're hoping to get out of it, what the reward is, and substituting in a different behavior. So like meditation and breath awareness is the ultimate way of unlocking any habit that we have for ourselves, because it's a way that we can slow down time and create a larger space between that trigger or that cue for whatever it is that we don't want to be doing, and the response. And in that space, in that, as that Viktor Frankl quote, like there is choice, right? There is freedom. It's a huge, huge life skill that I think is, it allows us to live skillfully when we cultivate breath awareness, and through that, meditation, really, like that's what we're talking about, right?
Yeah. And, Viktor Frankl was living in a condition that most of us hopefully will never, ever know in our lives. It was such an atrocious, situation he was living in, and concentration camps. And I think, going back to that idea that, the yogis, they felt like you could achieve this liberation even in the most deplorable social circumstances. And he is he showed us evidence that can be true.
Yeah, that's incredible. And a superpower. And it's like, yeah, right. that really, it's not about how crappy we think our lives are. Like we can do this from anywhere.
Yeah, I think if we don't allow ourselves to be embodied and to feel, I was just listening to a podcast by Tara Brach, and she was talking about this wilderness that we have inside of us. And when we are not in that wilderness, we're in what she calls a trance state, meaning that is that disconnection, that, caught in these habitual patterns of behavior, clocked out, checked out, dissociated, and being in that wilderness, although it is scary at times, it is such a gift to live from an embodied perspective, to feel all of these things that give us evidence that we're alive and we're human.
Awesome. That's so well put. And even the unpleasant stuff can remind us that we are alive, and that every feeling, every sensation is transient, and we get to experience all of it in this human form. Because I looped us back there. What's the value in feeling the crappy stuff that we don't want to feel?
What's the value?
Yeah. I mean, how does that connect us to our aliveness? Because you could be like, yeah, pain. It's like, yeah, I sure know that I'm alive. Why would I want to do that?
So I think that's a really interesting question. And just using, say physical pain, for example, physical chronic pain is something that a lot of Americans are struggling with. But even taking a moment and cultivating awareness. So we always want to start with intention and awareness. So say I was going to do, lead somebody through a chair-based yoga practice, right? Just sitting there in the chair. So most of the time I'm going to be hyper-focused on that pain sensation, right? Because our energy and our breath is going to follow our mind, so the prana follows the chitta, the mind. And so if I'm constantly fixated on that pain, that's where all of my energy is going to go. But if I take a step back and I sort of tap into the different layers of my existence, so I look at the quality of my breath, I'm looking at other sensations in my body. So maybe, yes, I have that pain there, but maybe there's also a part of my body that feels really relaxed and at ease and open and full of light, And then I'm going to also look at the quality of my mind. I'm going to look at my emotions. And maybe I'm even going to bring in some kind of visualization, in there too. Sometime in my life where I felt really calm and safe and peaceful. So I think there is a value because it allows us to cross the threshold into that inner universe where we can see that there are so many other things going on at the same time.
It's not the only, it might be a dominant feature of the landscape, but it's not the only thing in the picture, that we can choose to amplify our focus on these other things that make it more bearable.
Right. And through that through that transitioning into that inner universe, I can connect back to my true, authentic sense of self because that's there. It's just the light has been diminished because of all of these layers of suffering. So I think experiencing suffering, in a sense, opens us to what we really are, and all those other layers of our experience and our existence. And so I am not my pain. I may be a person who is feeling a great deal of physical pain right now, or a great deal of anxiety or depression or whatever it is, but I am not that, because there's all these other things that can be present at the same time. And that's that, that's that non-dualistic thinking that is more prevalent in the East and, versus the West.
Yes. And all these things are going to arise and abide and dissipate, except for that which witnesses.
Right. So it helps us to shift our relationship to the thing that we perceive to be causing us to suffer, if that makes sense. Yeah.
Yeah. So anything else that you would like for people to know about yoga therapy or its value or really anything? One last message.
Well, I think we have to remember that yoga, when we ask just, the average Westerner, the average American, what yoga is, the first thing that's going to come to most of our minds is people in, yoga clothes doing really advanced yoga postures, right? Because that's what we see. And I am here to say that that is just one component. That's one facet of yoga practice. And yoga does not have to be like that. There are so many other things that we can practice. And in ancient times, people weren't doing postures like that. Yogis were doing pranayama and meditation. That was the original Tantra Hatha yoga practice. And those asanas only came along. Those are in my teacher, Michael Carroll, Yoganan Michael Carroll from Kripalu says that was an influence of Swedish gymnastics.
Yeah, absolutely. So, a few hundred years ago, right?
Right. So that was a manifestation of, English colonialism in India. And so it's really like yoga is not doing, inversions and tricky arm balances. So, I can sit with a client.
It's union, right?
It's union, right?
Yoke and union are the roots there. So yoking together the different layers of our being.
Yeah. And Tantra is to weave. That's what that means. It's a way of integrating our experience. And, I can sit with a person in my office and do yoga therapy, and all we're doing is sitting in chairs, having a conversation, so it's more about sometimes just addressing, a person's thoughts and the quality of their mind and their behaviors and their history and, looking at it through the lens of some of these ancient teachings and, philosophies.
Well, I really appreciate you taking the time to educate us all about yoga therapy and what it's all about. If people want to work with you, where can they find you to connect?
Sure. So I'm based in Atlanta, Georgia, and my website is www.innerskytherapeutics.com, and they can contact me there. I do have a free PDF book that I put together on yogic approaches to stress management, and if you sign up for my email list, that will be immediately delivered to you. And I can be found on Facebook. So it's Inner Sky Therapeutics. That is the Facebook page, as well as I have an upcoming podcast that I'm releasing in October. And Brody, you were such an awesome guest, and I'm excited to release that episode. But that is called Ancient Tools for Modern Living. And there is
such a good title.
So there is a Facebook page as well as a closed group that people can join. And that podcast will be available on my website as well as iTunes.
Well, thanks again for being here.
Thank you, Brody. It was such an honor and privilege to talk with you today.
Thanks for listening today. For more episodes of A Healthy Curiosity, you can visit the iTunes store. If you appreciated today's show, please leave us a review. This helps other people to find the podcast. You could also head to brodywelch.com, where you can find free self-care resources, learn more about Chinese medicine, and let me know what you'd like to hear about on future episodes. I'd love to hear from you. Till next time, be good to yourself.